wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. I'm pleased to have my longtime friend of 57 years, Pastor Rick Scarborough, here with me to discuss regenerative joint therapy that we performed on him 3 weeks ago yesterday. Yes. And so, Rick, tell us about your history with your knee, exactly what's been going on and what recommendations you got when you saw your orthopedist.
My left knee was repaired when I was playing football in college. I tore the cartilage out of it. And then about 5 or 6 years ago, getting off an airplane with a carry-on, I caught the carry-on on the back of a passenger's armrest and hyperextended the knee forward. So I had 2 serious issues with that knee. And over time, it began to hurt continuous. I was living on Advil or anything else I could do to alleviate the pain and travel. I finally went to see a knee surgeon, the same guy that repaired my right shoulder in January or December. He looked at it, and I won't tell you what he said, but in his office, as I looked at the x-ray, he said, that knee is, and you can fill in your own expletive, but he used one strong. We both laughed about it. He said, I don't know how you're walking. The kneecap had shifted over, and the cartilage was completely gone on the good side, and it was bone on bone. But I'm heavily invested in this year's election, as you know, traveling all over the country, fixing to make another blitz up to Pennsylvania and places like that. So I said, Doc, I can't have the surgery now. Can we take injections and kill the pain so I can keep traveling, which he agreed to do. But the first injection I got was supposed to last 3 months. It lasted 3 weeks. That's when I came to see you. I prayed that as bad as my knee was, that something could be done to avoid the surgery. And so 3 weeks and a day ago, we sat in your office. I thought we were going to have a consultation. And the next thing I knew, there was 17 vials of my blood laying in front of me. I about fainted. You know how little I hate needles. So that's what precipitated the broadcast today.
Okay, so at that time, here at the Hotze Health and Wellness Center, we have a regenerative joint therapy program that uses natural substances that your own body makes to enable your joints to do 2 things. One, stop the destruction of the cartilage in your joints. When you get older, whether you've had an injury or not, it's always more profound when you've had earlier injuries in life. You had football injuries, you hyperextended your knee. People are joggers and they run and all these things. This wears down the knees, or people carry around too much weight. And over time, our bodies deteriorate as we're getting older, and we we start making certain compounds called enzymes, catalases and proteases, that eat away at the cartilage. It's kind of like, think of your cartilage on your joint as a garden. You got this beautiful garden outside, and you're waiting to get all the fruit and the tomatoes and everything up. All of a sudden, you go out, and there are beetles eating away at the garden and eating the leaves off, and the plants are dying. Well, this is what the protease and catalase enzymes do. They start to deteriorate and eat away at the cartilage. So you've got to put a stop to that. And you also have cytokines that are produced by the immune system that are highly inflammatory, so you get inflammation in the joint. Routinely, people, when this happens, take Advil or aspirin or some anti-inflammatory. They may be bad enough, like you did, get a cortisone shot in your knee. And then as it deteriorates, of course, your orthopedic surgeons are trained in surgery, so they know how to replace your joints. They can do a hip joint, a knee joint, a shoulder joint. So, but my philosophy is God's given the body amazing restorative powers that we can use natural processes in the body to give it a chance to heal itself, to tap into that regenerative mechanism that God's given in the body if you know what to use. So we took your blood, we spun it down, and took the appropriate proteins that are healthy proteins in your blood, and we injected it into your knee. So tell me.
I'd like to just tell your audience, you and I have been friends for 57 years, and I totally trust you. But I didn't know this was happening. I was sitting in a room eating carrots. And next thing I know, 2 nurses ushered me into the next room, and they're saying, Steve, and they're putting this substance into my knee. But the difference has been miraculous. That's all I can say.
Well, tell me about it. So how quickly did you begin to notice improvement in your knee?
In the 2nd week, I had learned to take stairs one step at a time. I'd plant my right foot on a step and then lift the left. Going down was even more difficult. And I'm in my office. There's elevators, but the closest exit is 3 flights of stairs. And so I'd always taken the stairs for health and other reasons. But it was all I could do to get up and down those stairs. But I want to just say, I got here today and it's 2 flights of stairs to your office. I can walk up and down them without using handrails. The difference I'm no longer taking any kind of pain pills or medication. Occasionally, like in the last few days with the storm that blew through Houston, I had to put all the chairs and all the equipment around the pool in the garage, keep it from blowing away. Then repeated that, plus cleaning up everything yesterday. And so today I felt a little soreness, but I think a 74-year-old man ought to feel a little bit of soreness occasionally. But the knee itself is functioning like it's designed.
And this was the first of 2 treatments. The first treatment is we put in your own substances from your own body that we derive from the blood. We put that in the knee and help stop the enzymes from eating away at the cartilage. Then we're going to inject into your knee some additional natural substances that will stimulate the cartilage to be reproducing itself. So this has all the possibilities, and our experience is probability that you're not going to need knee surgery. This is going to give health to your knee. And I would say the sooner a person has joint problems, I have a daughter, by the way, that's been running. She's a great runner. She's in her 40s. And her knees she's got deterioration. And as a matter of fact, later this afternoon, I'll be injecting her knees. So the sooner you can do this, the better. And this is what we offer, the Regenerative Joint Therapy here at the Hotze Health and Wellness Center. So you can heal your knee naturally, or your joint. It could be your hip, it could be your shoulder. You can heal it naturally so that you can live pain-free and enjoy life. And let me just ask you, what's the difference? I mean, if you've got joint pain in your knee, you know that all the time. Anytime you get up and move, go up and down stairs, it can be debilitating.
Well, mine was so bad that anytime I sat down, I had to find something to help myself get up. That's no longer required. My knees completely function as they did when I was 25 years old. I also was a runner for many years and kept my weight off by running 5 miles a day. I blew my back out doing that, so I had to quit. The lower disc just literally exploded and went up my spine.
Gee.
So I quit that. But I am a testament to anybody listening that the therapy is working. I'm 3 weeks into it. We got a ways to go. But in 2 weeks' time, I was beginning to feel normal in my left knee, and my body is functioning much better. And that's absolutely required of me because I'm going to live to be 100 years old.
Well, not 120. Moses lived to be 120, you know.
The last thing he did was climb a mountain, lay down, and go to sleep. It's not the best way to die.
They said, if you read, it says, and he died in his 120th year, and he had sparkle in his eyes and full of vim and vigor when he died. I mean, that's the way to go.
Well, my hero in the Bible is Caleb. He's 85 years old, and his brother said, "Now, which mountain do you want?" And his response was, "I want the mountain where the big giant lives. I told you 45 years ago I could whip a giant, and I can." And you know what he did? He did.
Well, speaking about giants, we know that joint pain can be giantly debilitating on your health, and it takes away from the quality of your life. Here at the Hotze Health and Wellness Center, we're offering regenerative joint therapy, and I wanted you to hear Rick's story because he's a longtime friend, and he's been texting me how good his knee's feeling, and he just can't believe it. So as opposed to when you got your cortisone shot, in 3 weeks it was back in the same way. And this seems like it's getting stronger and stronger, which we expect. And then once we do the next injection in it with more natural therapies, that'll help produce cartilage, and you should be good to go.
I'm telling you, folks, I believe in it. Thank you, Steve.
Thank you, Rick. And thank each one of you for joining us today. If you are interested in staying out of the surgery suite and having your knee or your hip or your shoulder removed, and you want to restore them and regenerate your joints to good health so you can live pain-free, don't hesitate to call us here at the Hotze Health and Wellness Center and visit with one of our consultants about our regenerative joint program that we have. Thanks so much for joining us. I'm Dr. Hotze.
At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physicians Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.